This video is about communicating information regarding frequent or prolonged fluctuations in health indicators of a person to the respective healthcare professionals and agencies. Health emergency is prevalent in most of the countries. Preventive measures are dependent on the health policy of the country. Heart can be realized by any person in need anywhere in the world. It could be a manual version using paper and pencil for recording fluctuations in basic health indicators by people living at a remote location or hilly region with limited information infrastructure in a low income country, or a person with the most advanced fitness tracking watch interacting with the state of art healthcare facility in high income countries. This reporting tool is designed with two objectives. First one is to alert healthcare agencies about fluctuations in basic health indicators of isolated persons living at remote locations with limited infrastructure. Secondly, to analyze fluctuations in basic health indicators to reduce health emergencies. Fluctuations in basic health indicators should always be limited. Frequent or prolonged fluctuations beyond a day or two need healthcare professional intervention to prevent health emergency. This health emergency alerting tool is a combination of a wearable device and its software application on Bluetooth connected smartphone. Software on smartphone analyzes data from Bluetooth connected watch or wearable device and communicates fluctuations in health indicator readings including sleep quantity and sleep quality, blood pressure, heartbeat rate, serum oxygen level SpO2, physical activity in the last 24 hours, outdoor training or outdoor activities in the last 24 hours, hydration or water intake, and body mass index or weight management reading. Several models with varying features are available in Indian market costing from Indian rupees 2000 onwards. One on left is less expensive watch with attractive user interface displaying trends and statistics but no sharing or communicating facility. One on right has a different user interface, expensive watch with sharing facility. The purpose of heart watch is to record fluctuations in the basic health indicators all the time to prevent health emergency. Basic health indicators are sleep quantity and quality, blood pressure, heartbeat rate, serum oxygen level, physical activity in the last 24 hours, outdoor training in the last 24 hours, hydration, that is water intake, and body mass index reading. Who needs to watch fluctuations in basic health indicators? Let us see. Firstly, those on medication with a diagnosed by health professional please include disease related health indicators in basic health indicators if they are not already there. Secondly, those having history of health emergency. Thirdly, healthy persons living in isolated places in remote location. 50 plus age group citizens. Lastly, those unable to follow World Health Organization recommendations on diet and physical activities. This video is for information only and is not intended as a substitute for medical diagnosis or treatment. You should not use the information to diagnose or treat a health problem or condition. Always consult your doctor or healthcare professional if you have noticed prolonged or frequent fluctuations in your basic health indicators. Thank you for watching the video. If you like it, forward it to those who might need. If you don't like it, message me the suggested improvements. Thank you once again.